Well, Ashley, thanks for your awesome talk today. That was really interesting. Obviously, from an orthopedic standpoint, I'm very happy to talk about bone and bone stress injuries. Curious how you got interested in it. You said that that's kind of your new thing now, is the bone stress injuries. What got you interested in that?
I grew up playing soccer, started to get into running more as I got older, and I run ultra marathons now, so we see a lot of runners in this area, and with running comes bone stress injuries. There's a lot of overuse injuries, and these bone stress injuries have turned into complicated cases that require a lot of people to get involved with.
Yeah, you'd said that's in your talk that it's increasing a little bit more, and you're tending to see that a little bit more. Why do you think that is?
I think a lot of it is young sports specialization. So we're getting these athletes who they start running at a young age and they're not participating in multi-directional sport, ball sport. And these multi-directional sports are where we develop athleticism and build that bone structure that can tolerate all these different loads. Mm-hmm. And if they're just participating in running and they're doing this single plane movement all the time, that's where they're not developing a whole system. And I think they run into issues down the road. And then on top of that, a lot of the training and coaching and all of that now are pushing people to do more and more and go faster. And we're becoming more competitive, which is exciting, but also I think we're missing the importance of rest and recovery and fueling and sleep, and our rest days being true rest days, not a rest day being let's go run around the park and do something else. It's let's go take a nap.
Yeah. And with that population that you're working with athletes, obviously they're ultra competitive. They want to continue to push themselves. Therefore, sometimes they push themselves and don't recognize that it's not the growth of what they're training. It's actually an injury that's starting with these bone stress. So what are some of the risk factors or things that they should be looking at to be like, hey, maybe I need to come in and see Ashley a little bit earlier than maybe just putting up with the injury?
Yeah, it's really important to catch these things early, because we can grade it on a 1 to 4 scale. A 1 is going to be a low scale bone stress injury. A 4 is going to be more of a stress fracture. So if we can catch it early, we can get them headed in the right direction. And sometimes that just requires pulling back on some training, maybe cross training. They're not needing to be non-weight bearing or in a boot or anything. But if we let that progress on and they come in and they're at a stage 3 or 4, that's when we're putting them in a boot. We're shutting them down for sometimes a few months at a time. A few things to pay attention to is if the pain is getting worse the longer that they're participating in their sport and not resolving over time, that's usually a sign that it could be a bone stress injury. If it doesn't warm up with activity, if it's aching afterwards, it hurts with weight bearing, but it doesn't hurt as much when they rest and get off of their bone. So if they can pay attention to a few of these things early and come in, even just for a screening to make sure that we're not letting it progress longer and we can do something about it, then they're going to be better off in the long run.
Personal experience, I have daughters that you've seen that are continually working towards their goals, and one of them specifically is struggling with some injuries right now that my recommendation was like, hey, we need to get you in to see Ashley and do some physical therapy. But she specifically said, I don't want to go see a therapist because they're going to restrict me.
Yeah.
Which is interesting. So you had talked about how sometimes that conversation is hard to have to have them restrict, but then get them back into progressive activity. How would you tell patients that are maybe listening that are nervous to see a therapist about restricting their activity, but that you'll be an expert to be able to guide them back into getting back into those activities a little bit quicker as a result of being able to see you?
Yeah, I think that is something a lot of people have issues with, and is something that limits them in going in to seek care, which is why sometimes it reaches a point where then we actually need to shut them down. But majority of the cases, we're not shutting them down. There's a lot of things that we can do without shutting people down. And I recognize there's a physical component, but there's also a mental component. And with these young athletes, or any athlete who loves doing their sport, shutting them down mentally can be very hard and more detrimental. So a lot of times it's just modifying. So maybe a runner is running 5 days a week and they're doing 2 hard workout tempos a week. Maybe what we do is we still let them run 5 days a week, but hey, we're going to back down your tempo work and just make those easy runs. Or maybe 2 of the days we have you bike instead of run. And then a lot of it comes down to educating and saying, hey, we're going to modify a few things right now, and it might not be fun to bike instead of run. However, if I let you keep running at these high paces, then in another few weeks, you might be at a worse spot where then you have to be completely shut down. And bone stress injuries are one of the very few injuries or a bone stress fracture, where we actually need to fully shut people down. Usually muscle, tendon, ligament, unless it's a complete tear, obviously. There's still a lot of things that we can do. And a lot of times, even like with tendon injuries, we want to load that tendon. So very rarely are we actually fully shutting people down.
Yeah, I think that's great. That's great advice, and I think a lot of it's that realm of what they don't know that they're going to expect as they come in and see therapy and kind of get those initial injuries treated. The last thing I want to ask you was about this part that you don't think about with training, which is the malnutrition or the adequate nutrition. As you talked about with that one case study, that he had a clean diet, which to you is a warning flag that he is doing some restricting. So obviously some of the things that we're seeing, at least in the orthopedic world, that's a buzzword for us, is the female athletic triad, the women who are really pushing hard in their activities, trying to make sure they maintain their fitness, but also maybe under eating and doing all that stuff. Can you talk a little bit about nutrition status and hormonal and kind of some of those things that also play a role with the bone stress injuries?
Yeah, so that kind of refers to RED, so relative energy deficiency syndrome, which can be seen in both male and female. And there's the nutrition side of it. So under fueling, that can be certain nutrients. It can be overall calorie intake. And I find a lot of these, especially like high school athletes, they're super busy. They're going to school or they're working out early in the morning and then they're working out right after school, and they're not necessarily thinking about fueling. And so I think just bringing awareness to say, hey, bring a snack with you, or make sure you eat a banana before you go on your morning run, eat afterwards. And then typically a good rule of thumb is anything over 90 minutes, you should be fueling during. So we think back to like when we were kids and they'd have like orange slices at soccer practice. I think that was great. And that's a great, like, we were excited because it was just a fun snack, but it's a good reminder that like, hey, nutrition is really important before, after, and during. And then also part with that, with the REDs is being aware of things like, as a female athlete, when are they getting their first period? How consistent is their period? Typically, if they're not getting a period until over the age of 15, that can put them at risk of a bone stress injury. And if there's inconsistency within that year timeline, that also can raise some red flags. And blood tests are great to get in terms of just screening tools. For males, low testosterone is a big sign, low bone mineral density as well. And these are all things that we can do preventatively as well. Iron is another one that you will see, but I'm not a nutritionist, but I can obviously give little tips and tricks here and there that will help at least like prevent and guide people in the right direction.
No, always good advice. Maybe you're not a nutritionist, but you're so good at everything that you do, and we love having you talk. So thanks today.
Thank you. Thanks for having me.